Good afternoon. How's everybody doing? Hope everybody's good on the virtual side as well. This is just a teaser slide, okay? We're not going to talk about dominion. We're not going to talk about the demise of mankind. So we are going to go to. So I think that it's important that we understand who I am, because why would I be standing up here if you didn't understand who I am? So you should be asking yourself, who am I? If you're not, you maybe know me better than I know myself at the end of the day. Because at the end of the day, every one of us, bar no one, has a purpose. But how do you know what that purpose is? Does it come to you as an epiphany? For me, my purpose has come to me through a fair degree of pain and a long, long time. My hope is that you gain some insight into my purpose, and by the end of this shared dialogue. So I am not a scientist, and I spend little time with numbers and the collection of data points. I'm sure that Jamie can attest to that. My mind does not work in this realm. What I have is not observational. What I have is experiential. Or philosophically, I am an aware or unaware scientist without controlled variables and without statistics to back me up. So, like the elder of a tribe, I have wisdom, nothing more. Today, we have made comments such as a call for action. And I can agree with that 100%, because One Health is not a program. One Health is not a funding source. And I can tell you that everyone on the One Health team knows exactly what I'm about to say. One Health is a state of mind. It's the way you look at the entire environment. It's the way you look at people. It's the way you look at the insect population and understand how everything is interconnected with everything else. And One Health is not US centric. One Health, depicted in this picture, is in Mongolia. How did it get to Mongolia? Well, One Health is not a US centric problem. One Health is a global problem. We indicated on my notes that it talked about working together. And that doesn't mean that we're working together only at the governmental levels. It doesn't mean that I'm going to Mongolia and working just with the Ministry of Health or the Ministry of Higher Education, or I'm going to Timor-Leste, I'm working with the Ministry of Defense. It means I'm working with the chief from the sub-district in Los Palos in Timor-Leste, because whether we want to realize it or not, sometimes policies are dictated by the chiefs and not by the government. We need to understand the people around us, and we need to understand the problem that we all face as a people. Often I ask my clients, I have clients, I do clinics, and in the clinic, I don't always talk about the dog or the cat. I ask them questions. And we talk about climate, and they say, well, what can I do? And that's a problem, because they can do nothing. We can do nothing unless we do it together. There is no way that we are going to change what's going on out there unless we do exactly what we are doing in this room. We are collaborating, we're using other professions to come up with solutions to complex problems, and the methodology behind it isn't that complicated. All you have to do is come up with a set of questions, you come up with a set of solutions, and you distill it down to which solution will have the least detrimental effect on the other two. Because regardless of what we do, if we're talking about insect control, you may have an effect on the insects, and you may have a slight effect on the environment. But you will also increase the health of the human population, potentially, understanding that mosquitoes do cross-pollinate. So we need to be very careful how we act in these spaces, understanding that everything has a purpose. It's no different than dropping a petal in a pond. There's a ripple effect that's felt across the world. It's no different than a child. No child should die of food insecurity in Africa when it can be prevented with supplies of food. We also talked about interagency cooperation, and we talked about coordination. I think we owe a debt of need to coordination when it comes to kids. So again, going back to what is my purpose? My purpose is to forge this One Health movement forward. And I will do it that to my end if need be. But it's not for me. I do none of this for me. I don't care about accolades. I don't care about awards. What I care about are these kids. Because if you look at these kids right now, we talk about climate change, the average temperature in Iraq, anybody know? Today is supposed to be 113 degrees. By Friday, it'll be 122. So if you apply that to the chart that we just saw today, there's a bit of heat stress. And these are abnormal temperatures. And the temperature typically drops below 70 degrees. This entire week, it will be 89 degrees in the evenings. That is very rare for this part of the world. So One Health is more than just simply the Mid-Atlantic. While we focus on the Mid-Atlantic because that's what we are doing, our efforts can have far-reaching effect. Because these children need aid, and that aid doesn't come simply by money. I would rather we give them a hand up than a hand out, a way forward instead of a way back. So if you ask me again what my purpose is and what I think we can do as a small, agile group of people, if you look at the last 2,000 years, there have been monumental changes, starting with the induction of Christianity all the way up through the world wars. And some of those were done by individuals and some of those were done by groups of people. We are at a precipice in time where we need to move forward. Most of you were around when I first started this. We started with a new beginning, correct, Jillian? And that quickly moved to an awakening. Now, unfortunately, if you look at this child, we need to look deep, maybe a little deeper. Maybe we need to look right in that child's eyes and find that now is the time that we really need to act. Now is not the time to slow and pump the brakes. Now is to get off the brake and hit the accelerator. So today, we did an exercise. And I would like everyone who is in the virtual world to do that same exercise. Fill that out. Send that in. Because you have no idea what impact that may have in the future. We have all of the ones from this session here. Once we collate it and somebody else does the data, because I'm not into the data, we will send that out. And this can be the stepping stone for us to move forward in the future when it comes to climate change, and protecting not only the human population, but the animals and the environment. With that, I have not a lot to say besides that. And I wish us the best of luck as we move forward in the future.